How important medication safety is, clearly, obviously, I think it's critically important. I think it's growing in importance. Again, we make many, many errors. We don't always see a really bad outcome from those errors, so we get used to making an error and having nothing bad happen. But the problem is, once in a while, bad luck, whatever, something really terrible will happen to a patient, and a patient will be seriously harmed. So we all have to take this very, very seriously. Medication error is one of the number one error that we make in the hospital. So if we could eliminate our medication errors, we would improve patient safety a great deal. Well, there are very specific recommendations that you can implement today that aren't necessarily really cost prohibitive. Certainly organizing that everybody in the department has the same organization for the medication trays, for the top of the anesthetic cart, so that it's predictable, so that when you reach into the drawer, you know where to find which medication. Certainly making sure that all the labels are standardized and are the same everywhere, and that everyone does it every time. And then working with your pharmacist, really pushing for a pharmacist to be available in the operating room in a satellite pharmacy. It always seems like it's expensive, but those pharmacists are doing those jobs in the central pharmacy, so it's simply moving them to another room. And the room can be small. Our OR pharmacist is in a closet, essentially. My closet at home is bigger than her room, and they are invaluable in terms of getting appropriately prepared, diluted, compounded drugs to you that are labeled correctly and that you know will be correct. So OR satellite pharmacists are really important.